Assalamu alaikum. Welcome to my video lecture class. I am Professor Dr. Mohammad Ashfaqur Rahman. Today we will discuss on the cervical vertebra. This is the vertebral column, we can see here. This is the vertebral column, and this vertebral column is formed by the vertebrae and intervertebral disc. These are the vertebra here, these are the vertebrae, and in between the vertebra, these are the intervertebral disc. So the vertebral column is formed by vertebra and intervertebral disc. Vertebral column has some regions, like this is the cervical region of the vertebral column, this is the thoracic region of vertebral column, this is the lumbar region of the vertebral column, and below sacral and coccygeal region of the vertebral column. We can see here that the bones in the cervical region or the cervical vertebrae, these are smaller in size than the vertebrae of the lumbar region or lumbar vertebra. This is because cervical vertebra transmit less body weight than lumbar vertebra. That's why cervical vertebrae are smaller in size. The vertebrae in the cervical region are the cervical vertebra, and all the vertebrae are irregular bones. All the vertebrae are irregular bones. We can classify the cervical vertebra before there are 7 cervical vertebra. So we can classify those 7 cervical vertebra into 2 categories. One is the typical cervical vertebra, another one is atypical cervical vertebra. Typical cervical vertebrae are from 3rd to 6th cervical vertebra. That means 3rd, 4th, 5th and 6th cervical vertebrae are called typical cervical vertebra. Why they are called typical cervical vertebra? This is a question asked frequently in the CAT final or term final exams. The answer is that they are similar in characteristics, they are similar in appearance, they have similar feature. So we cannot identify them separately. If somebody give us a 3rd cervical or 4th cervical vertebra and ask that which vertebra is this, cannot answer that it is specifically 3rd or 4th vertebra. Rather, we can say that it is typical cervical vertebra. And there are the atypical vertebrae are 1st cervical, 2nd cervical and 7th cervical vertebra. They are the atypical cervical vertebra because they have special feature, and by those special feature we can identify them separately. That's why they are called atypical cervical vertebra. All cervical vertebra has a cardinal feature, that is one identifying feature by which they can be separated, they can be distinguished from other vertebrae in the vertebral column, and that is the foramen transversarium. I can show that this is a cervical vertebra, this is a cervical vertebra, and we can see here that there is a foramen here. This is a foramen. This foramen is called foramen transversarium. This is foramen transversarium, and this foramen is present only in the cervical region, only in the cervical vertebra. No other vertebra possesses such foramen. So the most important and cardinal feature of cervical vertebra is the foramen transversarium. If any vertebra possesses this foramen, we can say blindly that it is cervical vertebra. Like costal facet is the cardinal feature of the thoracic vertebra, like mammillary process is the cardinal feature of the lumbar vertebra. Similarly, foramen transversarium is the distinguishing feature or cardinal feature of the cervical vertebra. Now it is a question why this foramen is present. Does it transmit any structure? Yes, of course. It transmits some structures. That's why it is present here. Which structures it transmits? Those are vertebral artery, especially second part of the vertebral artery, then sympathetic plexus around the vertebral artery, and then vertebral vein. These three structure, one artery, one vein, one nerve. Artery is the second part of vertebral artery, vein is the vertebral vein, and nerve is the sympathetic plexus around vertebral artery. These structures pass through the foramen transversaria. Now let us discuss on the typical cervical vertebra. We know typical cervical vertebra means 3 to 6 cervical vertebrae. They have similar feature. They cannot be distinguished individually. They cannot be identified individually. That's why they are called typical cervical vertebra. They are cervical because they possess foramen transversaria. So we can divide the vertebra into 3 main parts. One is the body. This is the body of the cervical vertebra here. This is the body of the cervical vertebra. Then this is the arch, body, then arch, and in between them there is a foramen which is called vertebral foramen. So there are basically 3 parts of the vertebra. In all vertebra there are 3 parts. One is the body of the vertebra, arch, and vertebral foramen. So let us start by the body. This is the body of the cervical vertebra, and it is smaller in size because it transmits less body weight. This body has 4 surfaces. This is the anterior surface, this one anterior surface. This surface gives attachment to the anterior longitudinal ligament. Then this is the posterior surface here. This is the posterior surface. Let me show you the stick. This is the posterior surface. This surface gives attachment to the posterior longitudinal ligament. In addition, there are some foramen. There are some foramen on the posterior surface of the body which are called basivertebral foramen. And these basivertebral foramen transmit basivertebral vein. Then so we have discussed on the anterior and posterior surface. Now this is the superior surface. This superior surface is concave from side to side. This is concave from side to side with upward projecting lip. So this is a lip, this is a lip. So 2 upward projecting lip. These projections are called uncal process. These are called uncal process. And inferior surface, this is the inferior surface. Inferior surface is projected downward. This is the projection. This is the projection of the inferior surface downward, and this downward projection ultimately hide the intervertebral foramen. So this is all about the body of the cervical vertebra. Now arch. This arch is formed by 2 structures. One is the pedicle. So this is the pedicle of the vertebra, vertebral arch. This is the pedicle of the vertebral arch, and this is the lamina of the vertebral arch. So 2 parts, pedicle and lamina. Pedicle is attached to the vertebral body in the midway between upper and lower border. That's why superior and inferior vertebral notch are equal in depth. Then lamina, and the direction of the pedicle is backward and laterally. Pedicle is directed backward and laterally. And that is the lamina. Lamina is directed backward and medially. Ultimately 2 lamina fuse in the midline. So that is the lamina. One lamina is attached to the adjacent lamina through the ligamentum flava. So pedicle and lamina together forms the arch. Now there are some processes of these vertebra. What are those? Number 1, this one is the transverse process. Here is the transverse process. And this transverse process possesses the foramina transversarium. This is the foramina transversarium. And ultimately, this transverse process is divided into 2 roots. This is the anterior root, and this anterior root ends in the anterior tubercle. Again, this is the posterior root. This is the posterior root. This ends in the posterior tubercle. And 2 roots are connected to each other by costotransverse bar. Costotransverse bar. So these are all about the transverse process of the vertebra. Now there are one more process, This is the superior articular process here. This is called superior articular process. It is articular process because it possesses articular facet, and that facet is directed backward and upward. This articular facet is directed backward and upward, and it articulates with the inferior articular facet of this above vertebra, upper vertebra. One more, this is the inferior articular process here. This is the inferior articular process, and this process also bear a facet. This is called inferior articular facet, and this inferior articular facet is directed forward and downward, forward directed. So these are the two processes here, superior articular process, inferior articular process. These two articular process together forms the articular pillar. So there are two articular pillars in each vertebra. Then this process is called spinous process. This is the spinous process. Spinous process has some characteristic in this cervical vertebra, that the process is shorter and bifid. Look, this process is shorter as well as bifid in character, bifid. So this bone, in the summary, here is the body and then arch. Arch is formed by the pedicle lamina. I have discussed all of them. Then there are some process, two transverse process, two superior articular process, two inferior articular process, one spinous process. And lastly, there is a foramen. This foramen is called vertebral foramen. Here, this is called vertebral foramen. When all those vertebra unite with each other, this vertebral foramen, all the vertebral foramen together forms vertebral canal. All vertebral foramen together forms the vertebral canal, and that vertebral canal contains spinal cord with meninges. So this is called vertebral foramen. In single vertebra, this is called vertebral foramen. But in all vertebra, all of them forms the vertebral canal. So this is the vertebral foramen. What is the content of that vertebral foramen? Content is the spinal cord with meninges. So this is all about the typical cervical vertebra, that is 3rd to 6th cervical vertebra.